All right, so here we are, third installment of prostate cancer diagnosis. I haven't been on in a few weeks. I was getting through Christmas and trying to figure some things out. So last time talked about the bone scan, surgery, possibly. Um, Surgery seems to be a better option for myself personally. Everyone's different. Each case is unique, I'm told. Um, so schedule the surgery. We're in beginning of January right now. Surgery scheduled for 1 month away, beginning of February. A little bit anxious about that because you don't know what to expect. Although I'm told that they'll be putting a catheter in me for about a week and send you home with a catheter. That much I know. Uh, but from someone who recently had it, I'm also told that it's an inconvenience, that it's doable. It wasn't really that bad. Um, Not really looking forward to surgery. Don't like surgeries at all. But it seems like this is the only way right now. Have to get it done. Don't want to do it. Have to get it done. So there's the anxiousness about that. I wake up every morning and think, where am I going to be after this surgery? What am I going to be doing? Am I going to have a bag hanging off the bed, full of pee, and you got to go empty it, and you got a hose hanging out you, and what do you wear? What do these are the thoughts that go through my head when I wake up. What do I wear? What am I going to wear that has this, that I can accommodate a bag and a hose? I'm sure the first week I won't be moving far from home, but point is you still have to wear something. So loose fitting clothing, I get it. But here's a funny one. What if your pajamas don't have a pee hole in front? What do you do with that? I guess just like anyone else, drop your pants. Anyway, yeah. So the other thing is they offered genetic testing to see uh, if it's a gene, if it's something in the family that I could be concerned about, or that maybe my kids could be concerned about. So that's a decision because there's certain things they can. I'm finding out that the healthcare companies can't really do much with that. But there's other things because it's genetic testing and it's shared. So there's things you got to decide that if it's right for you. I don't know. I'm not there yet. I'm not sure about that. On the next one, I'm going to tell you about my last experience with a really large university hospital in Philadelphia area. It was quite an experience. I decided ultimately not to get my surgery there because it was such a negative experience. But in telling one of my relatives the whole story, even though I laughed, um, he said, "Well, you may have a lawsuit there." I don't know about all that, but it was definitely a negative experience. So I'll share that with you another on maybe the next one. It wasn't. It was bad, the entire experience. But they helped me find this and got me to this point. So that was the positive. But we'll talk about that next. And in about 30 days, I'm having what they call the radical prostatectomy. Robotic surgery. They go in, remove your prostate, send you home with a catheter, and we'll see what happens. And they told me that because they have to move the nerves that are near the prostate, the nerves that control certain functions, one of them being erection, that there could be an issue. There may be an issue depending on, and the doctor also said, depending on how strong it is now, because most times it's diminished. And then he said the nerves could grow and get stronger, so that it could come back. But these are things that I'm thinking about. Aside from what if what if something goes wrong? Did I leave enough money for the family? Did I leave enough for my kids? I'm sure they'll miss me, but my concern is what if you didn't provide enough for them while you're here? That's a huge concern. Think about that every day. Every morning I wake up thinking about what's going to happen, how this is going to change my life. And I know there's people who have other surgeries that are worse and other cancers that are worse. But I'm just sharing with you my experiences. All right, well, good luck. I hope this helps somebody some way, somewhere. And if you have any questions, let me know. And on the next one, I'll share the funny yet screwed up story of the university hospital. Thanks. Good luck.